Thank you, Chairman Lujan. I like the sound of that. Commissioner Carr, before I get into my remarks here, I just want to say I hope you heard what Dr. Ransom said, and we give a lot of money out to folks who are supposed to put broadband in the ground, and they turn around and say, he's already got coverage when he's got crap for coverage. I mean, this is unbelievable. And so I think I'm depending on you, Commissioner, to put the boost to these guys when they don't do what they say they're supposed to do, because we're putting out billions of dollars. And telehealth is really important. I live in Montana. Weather, distance, those all make telehealth a winner. And I've heard from patients that they believe it's a winner. And quite honestly, I wasn't sold on it from a mental health standpoint in the beginning, but I've heard from veterans, because I serve as chairman of the Veterans Affairs Committee, from veterans that telehealth is actually better than in-person visits in a lot of cases. So there's just a lot of positive things out there for telehealth. And we've done a lot to help push the ball forward, as the senators know, through the CARES Act and through the December Consolidated Appropriations Act that we passed in 2020. Montana healthcare providers received nearly $1.9 million. That's real money. And it came through Commissioner Carr's FCC's telehealth program to purchase telemedicine software, devices, remote monitoring equipment, and more, ultimately delivering more quality care to Montanans. Because of this funding, Montanans, they can do it at home. They can do it at their a local hospital. It may not have the kind of level of expertise there that some hospital a ways away would have. So it's a real positive thing in a state like Montana. And I know that for those folks who don't know how to use a computer, or don't want to use a computer, or don't have the up-to-date computer, there's also audio options. And quite honestly, those provide some benefits too. I'm going to start with you, Dr. Ransom. From an audio standpoint, I don't know if you do any audio telehealth, but if you do, could you talk to me about its effectiveness? Because I do know the video telehealth is very effective. And correct me if I'm wrong on that. You're the pro.
No, sir. The video is very effective, and being able to see a patient and being able to have them hold their broken finger up or whatever it might be in front of the camera is quite beneficial for me in making a diagnosis and developing a treatment plan. Audio only is quite effective, especially the most effective tool is one that we can use, right? And so if my patient can't use video, it's of no good to me in their care. So the most effective thing is what they can use. And audio only is incredibly effective, especially for my older patients. I can ask a lot of questions, and a lot of times I can decide, do I actually need to bring this patient down to see me? And an audio consultation can give me the needed data that I have in order to do that. I would like to jump in and just say that when my patient, we know that the best care of these patients is in the patient-centered medical home. And when we have our patients who travel, they go to college, they do other things like you mentioned, specifically if they're out of state, I think I can give them the best care because I've known the patient since they were an infant. Frequently, when my patients go to college, I can call them. We can do telehealth visits regarding behavioral health, frequent medication refills, and things like that. So we do think we need to crack that nut of interstate commerce or interstate consultation, but we support the Interstate Medical Licensure Act. We think that it's incredibly important that there's still some state control for safety reasons over the physicians, and that act, though we think it needs to be less burdensome to apply in other states and less costly to apply in other states, we think it's incredibly important to allow that patient to stay within their medical home so we can give them the best services, be it audio or video. Thank you.
No, thank you for that input. This is a very simple question, and because I only got about 40 seconds left. We put in a bunch of waivers because of the pandemic on
Yes, sir.
telehealth. Number one, do you think that those waivers should be made permanent, or should we just extend them? What's your view on the waivers, and have they been effective?
I think the waivers have been effective, and I would be supportive of making them permanent. I think that we've entered a brave new world of virtual communication, and this is the best way for me to help take care of my patients in their medical home.
All right, thank you, Mr. Chairman. I want to thank you all. It's a good hearing. Thank you very much.
Thanks, Senator.